So today we're going to demonstrate the Spirox Latera implant. This gentleman has nasal obstruction. He was noted to have a deviated septum, inferior turbinate hypertrophy, and in the clinic we noticed that he has some lateral nasal wall insufficiency. And one of the ways we test for that diagnostically in the office is the modified Caudal maneuver. So first I have the patient take a deep breath through the nose. So take a deep breath. And one more time, take a deep breath. Good. So for the modified Caudal maneuver, I place my cerumen loop just to support gently without displacing the cartilage, the lateral wall. And then take a deep breath. Is that better?
Yes, sir.
We'll try the other side. And I'm just going to support the lateral wall without displacing it. And then take a deep breath. And breathe out. Is that better?
Yes, sir.
All right. And that's the modified Caudal technique. So now we're going to go into the operating room and we will start the procedure and we will demonstrate the Spirox Latera implant. So this gentleman had a endoscopic septoplasty, inferior turbinate reduction bilaterally, and sinus surgery. And now we're ready for the Litera placement. First thing we're going to do is mark the patient. So I take the marking tool, which is shaped and oriented in the same fashion as the implant itself, and I'm going to mark the inferior and superior aspect of the implant. We want the inferior portion of the Litera implant to be above the alar crease. The skin is thin here, and we don't want the Litera implant to be a thin skin there. And I'm going to mark the inferior and superior portion of the marking tool. I also like to mark the alar margin collinear with those two marks, and that is where I will go in with my bevel at the vestibular skin. So now we're going to load the deployment device with the Litera implant. We'll push this button here to open the chamber. This is the Litera, and we just drop it right here in the chamber. Make sure it's in. And once we check that the Litera is in the right orientation, we'll close the chamber and it's locked and loaded. So for the deployment of the device, we use a two-prong skin hook to give some counter traction and evert the alar margin. I'm going to go in with the bevel of the deployment device aiming towards the septum until I get in the correct plane. And then I change my angle. And then once I've changed my angle, I'm going to gently dissect with the device, staying in the supraperitoneal plane, aiming towards that superior mark, staying right on the bone. And I can feel it. And once I'm in the correct place, make sure that the prongs of the deployment device are aligned just as the Litera will be. Push the button to deploy. Slowly advance until you hear the click. I like to hold the fork of the device and gently remove the deployment device. Once it's in, I like to examine to make sure there's no exposure of the implant, and I like to feel, and it looks good. You can see the Litera if I gently apply some pressure.